started. First, we need to approve the minutes of February 24th. Could I get a motion to approve the minutes? Member Blair and a second by Member Duncan. Are there any corrections, additions? Okay. All right, please vote. Okay. All right, next we'll move on to informational items. And first we have the Board of Health. Is Steve on?
You said no. Sorry. Yes. Okay.
Hello.
Good afternoon. In your packet is two of our Board of Health minutes, both the January meeting and the February meeting. I think I touched base on this last time we met, but our board has introduced a new thing on the agenda known as Mission Moments, where we acknowledge staff that have gone above and beyond in the work of the mission of our agency. And so in February, we were able to recognize 3 of our staff that worked through a situation with a minor and got them the services they needed. And then this March, just last week, we recognized our 2025 Food Safety Excellence Award winners. And our mission moment at that meeting was our environmental health coordinator, Stephanie Straight, who not only has done a lot from just the idea of the community kitchen to bringing it forward, but also has led the Food Safety Excellence Awards for years. And so it's very nice to be able to bridge those together. Much of the agenda, though, has been focused on our food safety ordinance, which we have a special presentation for this committee here. But before we jump into that, if you have any questions about the Board of Health minutes or any items, happy to answer them.
Any questions? Okay.
So I think we have a presentation. I think, Scott, you're queuing it up. Well, while Scott is getting the laptop open and ready, I'll just introduce who I have with me. I'm joined today by Carrie Paneer. Carrie is our Director of Environmental Health. She'll be discussing with me to discuss the Chapter 10 Food Safety Ordinance revisions. Carrie has been our Director of Environmental Health since 2018. Prior to that, she was our Assistant Director of Environmental Health, and she actually began her career in environmental health as one of our sanitarians at the health department. So in terms of someone who has been with our agency from entry level all the way to that director role, Carrie exemplifies that. Also, that means she is very much a subject expert on much of this work. So before I jump into the slides, I wanted to just level set and give everyone a little bit of a summary of our environmental health program. The environmental health program oversees 3 of our core public health functions: food safety, on-site wastewater, and potable water or private wells. All 3 of these core functions have corresponding county ordinances. The largest of these 3 programs is our food safety program, which includes over 1,100 licensed establishments and does not include the hundreds of temporary food events that we do. Every fair, every pop-up soccer game where you see food out there, we do temporary events for that as well. So based on the 2025 Bellwether Fee Study, as well as the fact that right now in Illinois we have work groups working to update state statutes, we do plan to bring the on-site wastewater and the potable water ordinances back to this committee for revisions as well. For today's discussion, we will be focusing on Chapter 10, our Food Safety Ordinance. I would like to thank the Board of Health, the Food Safety Work Group, our environmental health team, and especially the state's attorney's office for all of their hard work. Jenny and her team, especially Essence, have been very responsive and provided great assistance and guidance through entire revision process. It was every answer we had, very quick response. So it was just great working with them. So we thank them. I did pass out to every one of the board members a copy of the red line version of Chapter 10 of our food safety ordinance. It was not put in the packet, and it's largely because of the timing of our Board of Health meeting to get it to this meeting. So that kind of quick turnaround time, we weren't able to get this fully into the packet. But you do have the copy in front of you based on the policy recommendations by our Board of Health. So once we get our slides up and running, for our presentation, Carrie will actually go over the executive summary as well as all the reasoning behind the recommendations and the revisions to the ordinance. And then I will actually discuss the fee study and how the proposed language that's really, I think, the big crux of kind of this change that we're putting forward and how it will impact our fees moving forward. And so as soon as we have the presentation up, we'll begin. The wait is worth it. The slides are amazing. Scott, you can go ahead to slide 3.
Okay. Oops, one slide back, please. So as a refresher, county ordinances can be more restrictive than state codes. We adopt state codes by reference. We just can't be any less restrictive. The recommendations that are in these slides are proposed from health department staff as well as our food safety work group. Next slide, please. This slide covers a little bit of our alphabet soup that we have in public health and environmental health. So HACCP is probably one that you're not very familiar with, and that's about hazard analysis critical control points, which talks about like food safety processes. ILCS is Illinois compiled statutes, LHD, local health department, LHPG, local health protection grant. These are commonly used throughout this presentation, ordinance, and just in public health world. Next, please. So the next two slides, I'm going to kind of mix and match a little bit, but we've proposed some added definitions, separated definitions, revising definitions, as well as some additional language. We're proposing adding definitions for risk categories to provide clear distinctions between the categories. These categories align with how we've previous practice in assessing food establishments, as well as align with what is currently being worked on at the state level. The state anticipates completion later this year, possibly early next year. And we were just trying to provide more clarification sooner rather than later to assist us as well as our food establishments in understanding the risk categories and those requirements. Charitable food organizations, the definitions are relevant to the sections that reflect policies that we implemented at the end of 2025, primarily carving out the ability to waive plan review fees for these to reduce barriers for places such as food pantries and other similar charitable food organizations while maintaining food safety. Commissary and shared kitchen clarifications. These definitions have been separated to clarify operational distinctions. Additional language will clarify commissary requirements for mobile food establishments that allows flexibility for those requirements based on their menu and food handling practices. The changes with commissary and shared kitchen clarifications will also improve understanding for operators within our county and assist businesses operating across state lines to help clearly identify inspection and approval status. We made some additions for private event and then some revisions to public event to reduce confusion overall and increase understanding so that we would have less, hopefully less back and forth about what it is when we talk about public versus private events. Next slide, please. So the new language for the 30 days clarifies that an annual food establishment license that does not renew within 30 days of their expiration will need to begin their process over again. Reopening would require plan review, etc. This addresses recurring issues with establishments attempting to maintain licensure without timely renewal or license holding without operations. Additionally, we have new language for temporary food service establishments to prevent temporary operations from operating in a manner consistent with permanent establishments without meeting permanent facility requirements. We further clarified that 14-day events are will only be approved for multi-vendor events. Rarely do we have any true events that are just one vendor. And then Monica will expand more on this part with her part of the presentation, but this section is adding language to delegate authority to the County Board of Health for setting fees and then removing that from the ordinance.
So I'll go over the fee schedule and just kind of understanding where the numbers are and how we want to move forward. I think the next few slides I'll go quickly through. Our county does do a fee study. You are all very familiar with this, and next few slides regarding the fee study process that was completed just last year by the county. In the next slide, this kind of goes very high level of what Bellwether looked at, including our current labor costs, the volume of our work, and some of our indirect costs. In the next slide, a little bit more detail about what was included in terms of our indirect expenses and our direct expenses. It is important to note that from our indirect costs that were looked, this was more of a summary of expenses versus maybe a cost allocation that has a little bit more definitions per each of those program areas and their specific operational scope. And so we know that there is some data and some cost that was not included in the Bellwether study, especially as it related to our indirect costs. So to help kind of provide guidance in terms of the fee study, I wanted to give a little bit of a history. This table shows the history of our food safety program's fee studies, including the 2011 Maximus study and the 2014 Bellwether. In 2018, the board adopted the 2014 fee study recommendations, which is our current fee study today. Based on the 2025 Bellwether study, the recommendation for the fees is provided, and in green, we are requesting to round up to the nearest $5 increment. So again, from 687 to 690. I think what's really important about this slide is it highlights the importance of conducting routine fee studies and assessments. Our current fees that we operate today are based on costs from 12 years ago. The jump seems large, and that's recognizing the amount of time that has elapsed between the last cost study and today. And so these updates to our fees are truly needed. In our next slide, this kind of gives you a better understanding of the environmental health budget. So our environmental health revenue comes into two parts. We have direct revenue sources and indirect revenue sources. For food safety, the primary source for revenue is our fees and the local health protection grant. You'll notice that I listed some other large grants that we receive, but if you guys are familiar with the grant world, we are only reimbursed for those services that are in that grant. So our IDPH lead and our HUD grant only support reimbursement for lead activities, not for the food program. It's also important to note the local health protection grant covers all of our core services. So I mentioned environmental health has 3 of our core services. One of our other larger core services is the control of communicable disease through investigation, surveillance, and follow-up. And so that funding also supports work that our disease investigators do or specialists do, as well as some of our nursing work as well. The last source we have is indirect revenue, and that comes through from our property levy, where that supports our indirect costs for our program area. On the next slide, to better understand it, this is kind of a historical context, looking at just revenue and our 2 largest sources of revenue for our food program, and that's our environmental health annual fees, as well as our local health protection grant environmental health allocation. What you'll see is over the past 8 years, which includes 2019, the first year in which we adopted our current fee schedule, as well as the 2026, which is our budgeted values. Overall, fees have essentially stayed flat in terms of what we've collected. So pretty much our revenue sources for our annual fees have been flatlined. As for the local health protection grant, the allocation has actually decreased over the past 8 years. Now, 2020 and 2021 are outliers as we received additional funding to support investigation and surveillance allowed from COVID, which allowed us to then put more environmental health on the local health protection grant allocation. On the next slide is a graphic representation of these, including trend lines, again showing that over time our fees remain flatlined over the past 8 years, and that our trend for local health protection grant has actually been decreasing. In terms of our actual expenses for environmental health, the primary expenses comes from personnel and mileage. So we do have a collective bargaining agreement, or CBA, as well as looking at health insurance and then our mileage costs. This table, similar to the revenues one, shows that the past over 8 years that you've seen an increase of our collective bargaining units, environmental health staff's minimum rates, the IRS mileage rates, and the employer's high deductible single coverage. So, for example, for our CBA, in 2019, the starting rate was $17.63. Today, it is $24.63. Similarly, our IRS went from 0.58 cents per mile to 0.725 per mile. On the next slide, this depicts just the wages as well as the mileage rate. So in this graph, wages, which is shown in blue, and on the left, y-axis, and then the mileage rates is shown in orange, and on the right, y-axis. Again, the trends distinctly show just the increase of our expenses over time. The comparison between 2019 and 2025 is very striking. As you can see, we have a 2% reduction in what we received in our food license fees, and a 17% reduction in our local health protection grant allocation. On the flip side of that, there's a 40% increase in our wage rates, 25% increase in our IRS mileage reimbursement rate, and a 127% increase in health insurance. A messy graph, but this kind of summarizes it by looking at the percentage changes over time. And you'll see the warmer colors, the purple, red, orange, are our expenses, and the cooler colors, the greens, are our revenue sources. And based on the trend lines, a clear trending of how expenses has grown substantially over time and our revenue has not maintained or stayed with it. We do look at other jurisdictions, but truly this is comparing apples to oranges. The ordinances for each of our counties are different, and they have differing supporting funds. So, for example, Tazewell County, which has landfill under the health department, uses its tipping fees to support its environmental health program. Reaching out to my counterparts in Sangamon, McLean, Champaign-Urbana, as well as LaSalle and Knox, all 5 of these counties are revisiting their fee schedules currently. And in fact, on the call just now, they asked me for my slide deck. So what does this mean in terms of the ordinance language? So we are proposing language that does change our structure in the ordinance. I have it written up here, but in the packets I shared with you, on page 13 is a language red line for all of you to see. In summary, on the next slide, it kind of highlights really what comes from this, which is that within the scope of county code, the county board has the ability to delegate that authority to set the fee to the Board of Health. It would have the county board of health establish and approve the fees. It will also have that we will be utilizing the fee study as well as any other which assesses program cost and revenue, as well as other data sources. And then there's due diligence done. So the Board of Health would get feedback from the Food Safety Work Group, our environmental health staff, Peoria County Health Committee, Peoria County Board, and other committees that we have within the state. That the Board of Health would approve with an open meeting to make sure we maintain that transparency. And then lastly, the fee schedule will be posted and shared as it is currently as well. I think it's important to note that the board, especially for our clinical services and previously for our dental services, they have historically set the fee schedule for those services outside of the board, the county board. And that's been based on the fee study, reimbursement rates, and the cost of labor and supplies, for example, our vaccine costs. By changing this language, this allows the health department to be much more responsive to changes in costs, what comes from fee studies, as well as any state statutory changes that also are associated with that, without necessarily having to open up the full ordinance. So in terms of next steps, to date, just to understand kind of how long we've been working through this, our Food Safety Work Group has been meeting since October of 2025 to start reviewing and approving recommendations. And they've met in both October, December, as well as in January. And then in January, our Board of Health had an informational session around the ordinance that was proposed. In February, they saw their first red line version of it. And then just last week, they approved the policy decision. We gave them 2 options to look at, one which maintains it within the ordinance, and the other one to pull it out and be a delegated authority. And they approved moving forward with a delegated authority model. In terms of next steps, based on the feedback we received today from the committee, we will be moving forward with the Board of Health at their April meeting, tentatively approving the ordinance change, as well as approving a fee schedule. If you can see in the subsequent steps, with that moving to the delegated authority model, then only in the health committee, April's health committee, and then the full board meeting in May, that you would be actually only looking at the ordinance. Once the county board adopts that in May, the approved fee schedule that from April by the Board of Health would then go into place at that time. Again, all of this will be dependent on the feedback we receive from the county board, but more than happy to answer any questions.
Thank you, Member Blair.
If this is moved to be approved by the Board of Health, does the public have an ability to have a public comment?
Yes, all of our board meetings have public comments as part of it. And I will articulate our food safety work group, and Carrie can talk more to that. But we recruit members from all variety of our food establishments, whether they are private entities, community-based organizations, food pantries, nursing homes. All of them are invited to participate in them. And they've been really active and involved in giving feedback as well.
Member Williams?
I had, excuse me, I had a question about the mileage. Has there ever been any comparison of possibly, of course, I don't know how much mileage these folks are using, but has there ever been a discussion about owning a vehicle?
Yes, I think that is something that we have looked at, especially as we've seen the IRS mileage increase, as well as understanding even risk management kind of aspects of it as well. I think the struggle is to recognize that we have 12 staff, 12 to 13 vehicles that we would have to rotate into that. And so just kind of talking through that process, it's a long-term planning, but it is something that we always look at and consider. Yeah.
Member Allison?
For the comparison, was there a reason that 2019 was selected and not like a 10-year span? Pointed you to start there?
So when the board adopted in 2018 the new fee study, the first year that it went into play was 2019. So previous to that, there was a totally different fee schedule for that. So that's why 2019 was the kind of starting point for that. But we analyzed the data all the way back to 2015, and the trends were very much the same. I just one moment to add. Carrie can speak more to this, but we've had a lot of counties. We've talked about how the ordinances are set up. Some are moving. Some have the model that we have currently. It's an appendix in their food safety ordinance. Others have done it where they create a separate ordinance just for all their county fees. And then the third option is the one you see today. In talking to all of them, they've all worked in some manner to make sure that the due diligence is there, that they are using their fee studies, they're doing annual assessments, they're maintaining that because as you can see, as costs continue to increase, it's really important for us to make sure that we are addressing that gap in that difference and making sure that the burden is correctly placed where it needs to be in terms of this kind of revenue source.
With the fees being the responsibility of the Board of Health, how frequently could they be changed at that point?
So our board actually annually reviews their fee study. So they actually do that already. Now, right, so for example, just this December, when they set their fees, they automatically reapprove whatever was in the ordinance for the food safety ordinance and our on-site wastewater and our potable water. With the county clerk's changes, those were adopted as part of that because of vital records. It's being the county. Much of how we do it is formula-based because vaccine costs can change drastically from year to year or even week to week. And so they've adopted a formula-based model for how we get reimbursed for or what we charge for our vaccines, for example. And then our STI clinic, similarly, they look at the fee study to set that. And we also, because clinical services and the type of communicable disease control it does, they've also adopted a sliding fee structure for that program. But they do that annually and they review it annually.
And I guess my last question is just looking to the future. I mean, currently we have a Board of Health that's responsible, but let's say 10 years from now, fees aren't being looked at properly, they're either raising too much or too low. This is something that the future county board could amend and take back.
Correct. And I defer to Jenny and Scott on how that process works.
You would just amend your ordinance again.
Okay. So it's nothing permanent. Any other questions? Okay, thank you very much. It's good information. Next, we are at emergency management. Easy for me to say. Good afternoon.
Good afternoon. I believe you should have my report in front of you, so we'll just kind of go through some of those events. I think I'll point out at first significant events. You can see we've initiated some planning for our annual summer camp music festival out in Chillicothe area. That takes up, we do quite a bit of planning and preparing for that event. Both you may or may not be aware, but OSH St. Francis gets contracted, so we end up there's a hospital basically out there to provide first aid from all 5 days. Additionally, we collaborate with them quite a bit with respect to severe weather. In fact, we just had a meeting this morning, and we recalled that last year on the first day we had some significant severe weather came in and had to work with them. So continue planning. Additionally, one that's not on there, but we'll begin initially planning for is Red, White, and Boom in downtown Peoria on July 4th, and particularly this summer in many of our large gathering events due to not only the geopolitical environment currently, but also the America 250, our celebration this year. Many of our large-scale events, we've had to increase some of our planning and preparedness, particularly on the security side, as those threats have increased. As we look at general meeting attendance, one of the things I'd point out in there is you'll see there's a number of committees. I've been doing this long enough. I don't know if it's a good thing or bad thing that I get put on all these national committees. I don't know if that's because they think I know something, or I'm just not smart enough to tell them no, or I just have a long enough term. But a number of NATO committees I sit on, particularly I'd point out the Preparedness Policy and Advisory Group Committee. It's one I take a little bit of pride in sitting on because it works and they provide recommendations to the CDC and Health and Human Services on our public health preparedness program specifically. And not an uncommon theme that you've heard and you probably hear from everybody, but as federal funding continues to be minimized, we continue to have to look at ways that we're going to continue to provide the services that we've been providing in the past. And so that Natural Preparedness Policy Group gives us the opportunity as local health departments to provide some feedback directly to the federal government on how those things have benefited us and in what ways we can begin looking at utilizing more state and local funds for our programs. Additionally, a nature committee that's not on here that I was just recently appointed to and had meetings for, and I think will be of great benefit for us as a community is I've been assigned to the 2026 FIFA World Cup Planning Committee so although the state of Illinois is not a host city for either games nor teams, they have reached out to us. They recognize that throughout the month that we're hosting the World Cup here in the North American continent, they will be seeing visitors from around the world. And again, considering the geopolitical environment, in addition to just things regarding infectious disease, particularly on the public health side, is recognizing that a number of visitors to our nation may or may not be vaccinated for certain things that are endemic or prepared for. And so we continue to have to prepare for those things. And anytime we get the opportunity to assist in preparing for like a large event like that, I think it benefits us. Again, for our Red, White, and Boom, or in the event that our community is fortunate enough to host another large event at some point in time. As we look at our exercises, you'll note a couple of things I want to put on there. One of the things is that we recently met with the Maritime Security Council. We had a senior officials workshop to really dive into issues regarding incidents along the river, specifically respect to who has the responsibility to respond to incidents on the river, who has the authority to respond to incidents on the river. So we continue to seek guidance and have discussions about specifically, we've got concerns, obviously, as we move towards Red, White, and Boom. We look at this year, and historically, Fond du Lac Park District has taken on the majority of the response on the Illinois River, and it was kind of just by default. They had the equipment, but they've expressed to many of the responding agencies that the funding streams that they've used to do responses outside of their jurisdiction is becoming difficult. So our senior officials workshop, we're really trying to get an idea of who can do what and how they can do that on the river, being that it's kind of it's a unique aspect of our community. Additionally, we did a couple weeks ago, you may be familiar that we've talked about since I've been doing this work for 20 plus years. Our primary responsibility at the local health department is how we would dispense a medical countermeasure to the public. Primarily, we focus our attentions on how we would get anybody an oral antibiotic as a result of an aerosolized anthrax event. So we recently did an exercise of that with our staff to begin, and it's excellent opportunity for us. I'm honest with everybody with regards to it. It's very frustrating for me because I've been doing this planning for 20 plus years, and I can't understand why we continue to have to plan for something like this. And then I get reminded that over 60% of our staff has started since 2020. So and so we're kind of changing our model internally and how we do some of our planning. Is that as we've seen our staffing model change, and as we see the longevity of some of our staff members, we don't really see as many individuals staying with us for as long. We're looking at different ways we can train our staff to ensure that they're prepared when something happens, but yet we're being cognizant and not of our time and resources in planning for those things. So, and then moving towards severe weather season. So we've had at least one incident of severe weather. I think there's a chance of severe weather Thursday. Next week, there's another chance. So with that being said, I encourage everybody to continue looking at their severe weather plans. We continue on our outdoor warning siren network discussions with community partners on what and how we can enhance that. And in fact, we should be moving into some type of public outreach throughout the summer. I'm working with Gretchen and Tim and Stacy in the city with respect to that. I'm looking forward to speaking with Superintendent at Dunlap High School following the incident last Friday. And I believe they have an after-action scheduled for tomorrow that I'm unable to attend. But in speaking with Superintendent Dearman, we're going to talk at the end of the week. Primarily what we're looking at from my perspective with regards to that incident is not so much what happened on the school campus, but particularly want to have some discussions with some of the transportation-related issues that had appeared and some traffic-related issues. And again, I qualify all of this when we play armchair quarterback. It's not to point out what people did wrong, but we'd like to know what went well and then what gaps can we address, specifically recognizing that we host several large-scale events in our community, and that if we had an incident of that nature, what can we do to alleviate or eliminate the potentials of some of the traffic issues and some of the issues of people trying to reunify with their loved ones, but yet following a process that's been set in place and not just arriving at a location that probably they shouldn't be arriving at because it just creates more difficulties. And then finally, you're well aware the board has made discussions regarding the EMA bunker in Kickapoo, Edwards, Adam, and so as we continue to work with county administration in that, I can as that process has begun to unfold, I continue to field questions from not only members of the public, but our community partner agencies on what that looks like for the EMA, if and when we get to the point with that building no longer there. And as I've mentioned to some of you, and I haven't worked out of that building for almost a year now, so it's got very little impact on the Emergency Management Agency. The majority of the impact is with the ETSB and much of the equipment that belongs to other county agencies that's in that building and what we can do to help take care of that. So.
Okay, thank you. Does anybody have any questions for Jason? No? Thanks for all the information. Appreciate it. All right, next we have the Regional Office of Education. Good afternoon.
Hi, how are you?
Good, how are you?
Good. I don't know how many times I'll knock that down. The table's not designed for big people. We don't have any updates. We're just in our normal work and chaos with our districts right now. And so we want to be available for questions that you might have. You also have the information in front of you as far as our most updated truancy information. So Kara and I are here to answer any questions that you might have for us.
Any questions? No? Well, that was easy.
Yes, thank you.
Keep up the great work. All right, next we have Sustainability and Resource. Good afternoon, Becca.
I too will keep my my update pretty brief. Batteries, in terms of collections of batteries, we continue to look for opportunities and have some lined up that I should be able to bring to you next next month for some expanded locations for collection of batteries. Now that we have extended producer responsibility for that. Household hazardous waste. I just wanted to mention that Tazewell County did host theirs this past weekend, and they had a great turnout. And I don't quite have that breakdown yet of Peoria County participants from them, but they did say that they saw nearly 1,000 cars. So pretty great turnout. We promoted that heavily. Recycle Coach continue to expand upon that as we upload more and more communities with their specific routes and collection schedules. We had 2,691 interactions last month on the app. I wanted to highlight the fact that the Township Supervisors Group, I'm going down the report as I always do very quickly. The Township Supervisors Group meets April 8th. So if anybody would like to attend that, we're meeting at Limestone Township and reach out to me for more information. Sustainability update in terms of the sustainability team. Later in the agenda, we have a resolution to bring you the final sustainability plan update / energy plan. We did host 3 public meetings at the beginning of the month and got some good feedback from the people who did attend. So at that, I will ask for if you have any questions at this point.
I have one. In regards to the paint drop off, and I know you specified certain sites. Is there a time or limit on that?
No, there is not a limit, and there is no fee at any of those locations. If you have a large quantity, it would be courteous to ask them. But if you have less than 15 cans, they're prepared to accept it. Yes.
Any other questions? Go ahead and hang out. I'm gonna jump over the next informational item. We'll get to the resolution and then we'll jump back to the strategic plan. Okay. So I'm going to jump down to the resolution, which is the 2026 Sustainability and Energy Plan. So could I get a motion to put that on the floor? Member Allison and a second by Member Blair. Okay.
I do have a few really quick slides. I know we've discussed it a number of times in the last few months, but just wanted to provide a little bit of history as to how we got here, knowing that it's been a while that we've had an internal operational sustainability plan. So we can go ahead and go to the next slide. Thanks, Scott. So in 2010, part of the strategic plan from the county board was to draft and adopt a sustainability plan. So we did that at the end of 2011. There were a number of progress reports throughout the year, a couple of progress reports throughout the year, and also 5-year updates. So 2026 would be our 15-year or third update of this living document. So if you want to go to the next slide. That original plan highlighted 6 main areas of action, as you see on the screen there. And we continued to stay close to those as we moved on to our next plan. So, yeah, I'm going to go real quick. So again, those progress reports and the showcased a number of progress and successes that we had initially with the sustainability plan. I do like to highlight this, and I showed it in the public meeting as well. Our key for exceeding goal, meeting goal, and have not met goal. We did not have the best metrics initially, and that was in line with other counties and other agencies, and we've just gotten better at tracking good metrics and having SMART goals. So I think you'll see that as we continue to move forward. So this is just a couple pullouts of some of those first progress reports. Lighting was our first area of focus because it was an easy, quick solution to saving energy, and quickly helped us to realize some of those goals. So one of those that I wanted to highlight was the parking deck, which was done in 2017. In 2018, $17,000 was budgeted, and the actual spend that year was $8,116, which then reduced the 2019 budget by $5,000. Again, that's a 24/7 building, updating to LED lights. Right for the next one. All of our buildings have been updated to LEDs. Some of those were going from T8s, some of them were going from T12s. Well, one of them was going from T12s specifically, and that was highway. So this one is called out. This was the first Ameren incentive that we sought, and we got $13,556 for public sector Ameren incentives. And this was to go from those T12 fixtures to LED lights. It was installed, the glass bulbs were installed at the end of February in 2019. So what you're seeing on the screen, I know it's a little hard to see, is the 2019 over 2020 February usage, with the spend being $751 in 2020 and $1,222 in 19. That upgrade alone was 17.6% reduction year over year of energy use for highway with just the light updates. Of course, we did a number of education campaigns along with that, and that was highlighted in the progress report as well. We won a few awards. If you want to go to the next slide. Due to our implementation, we did win an Illinois Governor's Sustainability Award. We had a few LEED certified buildings. Again, the plan calls for building to that standard, to LEED Silver standard, even if we don't seek certification. We did get 5th overall in the state for the Green Office Challenge. So we had some great success that way too. And moving into our update for 2026, in 2024, we did apply for and receive the Energy Efficiency and Conservation Block Grant Program of $100,000. And that money was spent to do the buildings assessment that was received and filed by you earlier in 2025, middle of 2025. That also helped to inform, go to the next slide. Okay, I guess I skipped that part. Okay. That building assessment looked at a number of items, the mechanical, electrical, plumbing. It looked at the structure. It looked at the surrounding property around each of the buildings in the site. It made observations and recommendations with a rating of between 5 for excellent and 1 to poor. And I know you're each familiar with that. This new plan that we're doing is the final deliverable. Again, something we would have been updating anyway, but is the final deliverable for that Energy Efficiency Conservation Block Grant. This plan not only looks at those same areas, we've renamed a few things throughout the years. So we do still have the same 6 areas of the plan that you saw from the 2011 plan, with a couple name changes. We changed employees to workforce. We changed solid waste to resource management to align with our current resource management plan that we have that previously was called the Solid Waste Management Plan. An increased focus is found in this plan on energy resilience, reporting, and accountability. Go to the next slide. So with the plan that is included after each of those areas of the plan, you'll see the overarching timeline and metrics. Some of them have specific goals outlined with a % reduction or a % addition of something. It lists the accountable parties, with sustainability and resource conservation being across all of them, but also which internal department we'll be working with to help to get those metrics or track progress and ensure success. And if there is not a specific goal laid out in the metrics, we expect to see progress across all of these areas by our next update in 2030. We do have a dashboard that we have in the works, and we will host this on the website so that not only will it be me reporting to you what energy usage looks like, but also the public or you can go in and click on any individual building and see the historical energy consumption for that building. You can compare building to building. And then we also are working to build out a few story maps to explain why we see the differences between energy use, and to do some education on energy use intensity and how we're using our spaces, and occupancy, and a number of other things that can help to explain what energy usage looks like. That is what I have for you, and I'm happy to answer any questions that you have about it.
Any questions? No? Well, thank you for all the time that you put into this and the professionalism and enthusiasm that you have towards it. With that, Everybody please vote. All right, that's unanimous. Thank you very much. All right, now we're going to jump back up to the strategic plan first quarter.
Good afternoon, everybody. In your packets this week is the first quarter update to the strategic plan action items for 2026. This is a new format, but isn't different from how we were reporting the action items from previous, but it's a more narrative format. And you'll be getting your second copy for Q2 in July of this year. I should also note that the strategic planning page has been updated as well with the 2026 action items, including percentages complete. I'd be happy to answer any questions about these or defer to subject matter experts.
Thank you. Does anybody have any questions? No? Guess not. Thank you.
Thank you.
Okay, next we have public comment. Seeing none. Miscellaneous? Nope. All right, we're adjourned. Thank you.